Gestational hypertension is a whole spectrum of high blood pressure in pregnancy. And on the one hand, you can have gestational hypertension, and then it goes all the way to eclampsia. So gestational hypertension, all that means is high blood pressure in pregnancy that develops after 20 weeks gestation when a patient previously had normal blood pressure. And the patient can go on to develop preeclampsia from there, and that just means that there are some signs of end organ damage. For example, protein spilling into the urine is one of the key signals that a patient is going on to develop preeclampsia from the gestational hypertension. A patient with chronic hypertension can also develop preeclampsia. So the main thing that's really important for patients to know is that regular visits with your OB/GYN or your doctor or your midwife during your pregnancy is really important, because at those visits we're always screening you for gestational hypertensive diseases and checking your blood pressure, checking in on your symptoms to make sure that you and your baby are safe during pregnancy. So gestational hypertension typically resolves after delivery, within about 12 weeks of delivery. It is important that patients know that if you have high blood pressure during pregnancy, you're more at risk of developing chronic hypertension outside of pregnancy. So following up with your primary care doctor or your obstetrician after you deliver is really important. Some of the warning signs are headache, and it's really a headache that is persistent despite trying Tylenol, ibuprofen if you're post-delivery, rest, hydration, and then if the headache is still persisting, you should really have that headache evaluated. Another symptom would be like spots in your vision, so little black dots in vision. Pain underneath your right breast, sudden swelling, or otherwise just general onset of malaise and fatigue and feeling unwell. I think I always encourage patients to have a low threshold to reach out or come in and see one of us after they deliver. With eclampsia, that's the most severe end of the disease spectrum, and that's when patients have seizures during their pregnancy or in the postpartum period. And some negative consequences that can develop after that are patients can have brain swelling, brain damage, and strokes. It can also cause like heart problems. It can also cause, if you're still pregnant, seizures in pregnancy can be dangerous for the fetus as well. And so one thing that can happen is called placenta abruption, where the placenta separates from the uterine wall, and that really necessitates an urgent or emergency section or delivery. It's really important that patients be seen by their OB/GYN if they have high blood pressure at all during their pregnancy. We encourage them to come back 2 to 3 days after they deliver to make sure that their blood pressure is trending in the right direction. We always keep an eye on our patients. We see them again usually 2 to 4 weeks after delivery, and then again at the 6-week mark. And then we typically send them back to their primary care doctor if they continue to have elevated blood pressure, because at that point it's typically a chronic problem. I think just knowing that gestational hypertension, preeclampsia, these are common things that we see during pregnancy. It affects about 1 in 6 to 1 in 8 patients, and it certainly is very manageable, and we can keep you safe. We just want you to come to your visits regularly and make sure that you reach out with any questions or concerns. So the risks of having gestational hypertension are history of gestational hypertension in a prior pregnancy. Obesity is one as well, or being overweight. Patients that have had high blood pressure outside of pregnancy, advanced maternal age, so being over age 35. Those are kind of the key risks. And then additionally, patients that have diabetes are at risk of developing blood pressure issues during pregnancy. So in terms of treatment and management of gestational hypertension during pregnancy, we don't recommend bed rest anymore. We recommend exercise. Actually, that can be very helpful to decrease your risk of going on to develop preeclampsia in pregnancy. Healthy diet is important. Low salt intake is also important. And then making sure that you're coming into your prenatal visits regularly and getting your blood pressure checked at all of those visits. We also screen you for blood tests and urine tests to make sure that you're not going on to develop preeclampsia during your pregnancy. And then other things to note are that we'll often monitor your baby more frequently during your pregnancy just to make sure that they're doing okay, because it can lead to growth restriction. And so we often monitor both with NSTs, so just looking at baby's heart rate at the latter half of your pregnancy, as well as getting growth ultrasounds every few months.